Hey everybody, it's Steve from Nesta Physical Therapy here. Back to you again with our top 10 golf injuries. But before you tune out, if you're not a golfer, we're talking about something that anybody can get, and that's plantar fasciitis. Okay, what's plantar fasciitis? Well, it's inflammation of the tissue across the bottom of your foot. It runs from your heel through your arch towards your toes. And plantar fascia is the structure. Itis means it's inflamed. Okay. Some people, I've also heard it called policeman's heel. Okay. What are the classic signs of plantar fasciitis? Well, first one is heel pain. Right on the bottom of your heel, it's super painful. Okay, the time it usually gives people the most trouble is getting out of bed first thing in the morning. You put your feet on the floor, it hurts like anything. I've had it myself. It's not fun, but you got to do something about it. So again, classic sign: heel pain, getting out of bed in the morning. The other classic sign is if you've been active, you sit down for a while, and you go to get back up. Things stiffen, you get up, you try to move them again, and it's painful. So whether you've been sitting in your office chair for a while, or you played some golf, you walked 18 holes, you get in your car, you drive home, you go to get out, your foot's sore again. Okay. Some other things, you might have some stiffness in your feet or in your foot. You may get some calf tightness or even calf pain. Sometimes the heel pain will wrap up around the side of the heel and travel up towards your ankle. So those are some of the classic signs. Okay, what can cause plantar fasciitis? Well, it's usually a change in your activity. Usually an increase in activity. So whether it's you're walking more, you went from walking 9 holes to 18 holes, or you have a job where you have to stand longer. If you're some sort of standing job, you're on a hard floor, that can impact it too. So the floor or the terrain, you stand on a hard floor, you stand on a rubberized floor, you're walking a flat golf course, so there are a lot of hills, can impact whether or not you're going to get plantar fasciitis. Footwear is a big one. Are you matching your footwear for your activity? Are you wearing flip-flops to the gym? Is your footwear worn out? Okay, if your bottom of your shoes are worn out, maybe time for new shoes. Maybe you need new golf shoes. Maybe you need a new pair of boots or a different type of shoe if you're going to stand all day. So look at your footwear. So we've got some classic signs of plantar fasciitis. We know how it may happen. Okay, so more importantly, what are we going to do about it? Well, here's a couple easy things you can do at home if you feel like, hey, I'm starting to get some plantar fasciitis. Okay. The first one is really the best, is to rest your foot, but we know that doesn't work because you can't rest. You have to go to work, you got to go to school, you got to go play golf. So resting is tough to do. So a couple things you can do: self-treatment. Okay, the first one is some self-massage, and that can be done with a golf ball. So you grab a seat, and we've lost our golf ball. You put and you can see why my next suggestion makes sense. Is we're going to take a golf ball, you can put it in a sock or a pillowcase, you put it on the floor, and you can massage the bottom of your foot with a golf ball. It digs right into the heel, the plantar fascia, and it's a way to do some self-massage. Okay. Some other people will use a frozen water bottle, and they basically numb their foot, and that usually helps with some of their pain. But sticking this in a pillowcase or a sock keeps it from running around. You saw me drop it and it started to roll around. So that's another little tip. Okay. Mention you may get some calf tightness. Okay, there's another little device you can get online, or you may find at your local gym. It's called the stick. Okay, little self-massage. Okay, we talked about footwear. Changing your footwear, getting new footwear is maybe part of the treatment. The other thing is inserts. Okay, that may help with plantar fasciitis, and there are different levels. There's stuff you can buy right over the counter. $50–$60. There are other things kind of middle of the road that a lot of chiropractors, physical therapists, and trainers will sell to people, kind of middle of the road price. And then there's the custom-made orthotics. I'd tell you, don't try some of these more conservative things before you run out and get custom-made orthotics for two reasons. One, they're expensive. Two, insurance doesn't cover them. And oftentimes, and I hear this from patients, hey, I got these expensive inserts, and I said, well, where are they? Oh, they've been in the closet for months because they didn't help. Okay. Some people wear night splints. There's a thing called the Strasbourg sock. It pulls on like a big sock, keeps your foot pulled back and stretched out overnight. So when you go to get out of bed in the morning, the plantar fasciitis, or the plantar fascia in your calf is nice and stretched out. Makes it a little easier to get up and get going in the morning. Two other things you can do, or one other thing, but I have two versions. Some calf stretching. So I'm going to show you two calf stretches, real simple for home. I'm going to lean on the table, you can lean on the wall, and I'm going to stretch my left calf, put my hands on the table, I put my foot back, my knee is straight, and I just lean in towards the table or the wall, wherever you're stretching. But I'm stretching my calf muscle right about here, A subtle little change I can make to that is I put a little bend in my back leg, just like this. Now the stretch moves from my calf down closer to my ankle. Those are two really easy stretches you can do to keep your calf loose. Why is it important to keep your calf loose? Because your calf muscle is attached to your heel. If that's tight, it pulls on your heel, which then pulls on your plantar fascia and can make some of your symptoms worse. So there we have it, plantar fasciitis. It's painful, and it doesn't just go away on your own, so you do have to take action. Hopefully some of my tips are helpful. If it doesn't go away, I encourage you to seek help, whether you see your doctor, your podiatrist, your orthopedic, or your local physical therapist. But take action, and I hope this was helpful for you golfers and non-golfers. Take care, and we'll catch up with you again next week.